Patients with insufficient bone structure in the upper jaw may be candidates for the placement of zygomatic implants. We offer them as a cost-effective alternative to traditional bone grafting methods. This advanced method is often used for patients who were previously told that they were not candidates for traditional dental implant procedures. Zygomatic implants are longer implants which are placed in the cheekbone, or zygoma, bypassing the upper jaw. The bone in the zygoma is more dense and solid than the bone found near the back of the upper jaw. During the procedure, 1 to 2 zygomatic implants will be used on each side, with traditional implants placed in the front to form a solid foundation for a full arch of upper teeth. The bridge is placed on the same day as the implant surgery, providing our patients with a cosmetic and functional set of teeth the day of the procedure. Our experts can assess your condition and work with you to develop a treatment plan for the restoration of your oral health and smile.